Welcome, and thank you for joining Virtual Coffee with Gail and Janet. Let's talk health and Medicare. I'm your host, Gail Lee Lawrence, along with Janet Ramirez, and we're here to give you information on health insurance and Medicare. And today we want to, for the next 10 minutes, we're going to especially talk to those who may be losing your job or turning 65 or thinking about retirement, and we might throw in a few other things too. But you can always reach us at 817-381-1500. Leave a message with detailed messages if you have a question or if you need advice about anything, and we can help you. You can also reach us at our website, gelhealthadvisors.com. Okay, let's get started. Okay, if you're under the age of 65, you may qualify for the Affordable Health Plan at the marketplace. This is called Affordable Care Plan here, the ACA plan, and it's for people that are age 65 and under. Now, special enrollment period for the Affordable Care Act is November the 1st through December the 15th. But if you miss that open enrollment date, you might qualify for what's called a special enrollment period. And within the special enrollment period, it happens on the different things. For example, if you're losing your job, you may qualify. We have a very strict timeline to get this done, but so give us a call as soon as you know things are happening. If you're turning 19 and were on Medicaid, you have a qualification, a special election period. Give us a call. However, there are times when you might be on Medicaid and you might lose that Medicaid. We still may be able to get you in a health insurance plan. Now, if you're turning 65, say you're retiring or you may be retiring early and you're not able to keep your health insurance, we can get you on a health plan and get you ready for Medicare when you're turning 65. Medicare. Medicare, when we think of Medicare, I want you to think about when you were back in school, we had our A, B, C's, and D's. So we're going to explain this to you a little bit later on, but this is what I use for my Medicare symbol. I call it my A plus B equals C and sometimes D. We're going to find out later on. Let's call it Medicare Advantage plan, but I don't want to get ahead of myself. First of all, like I said, when you're turning 65, you qualify for Medicare. You can also qualify for Medicare if you've been on disability for 2 years. The government said you've been disabled for 2 years, you will automatically be enrolled in Medicare. And when that happens, give us a call so we can assist you, because there are some other things that you need to do. If you have certain chronic conditions such as end-stage renal disease, Lou Gehrig's disease, and a few more, you may qualify for Medicare. Now, Medicare, when you start qualifying for Medicare, especially when you're turning 65, dates are very important, because if you miss certain dates, you could be having forever penalties, and you do not want to have those penalties. We'll talk about those a little later. But let's look at this. If your birthday, let's say your birthday is in May. If your birthday is in May, we can start getting you enrolled in February. It's 3 months before your birthday, the month of your birthday, and 3 months after your birthday that you qualify for Medicare. So we want to go ahead and get you enrolled in that. So give us a call. Just as what we would like to do is start working with people 4 months before they qualify for Medicare, so we can get a lot of questions answered, find the best plan that fits your situation and your financial condition, your medical situation, your just extra need benefits, a financial situation. We want to make sure we have the plan that works for you and assist you in that. However, you are the one to make the decision. We're just here to assist you. When I said dates are important, we want to get this done in a timely manner and on time, because there are certain times if you miss certain dates, you could have forever penalties, and we want to avoid these penalties because they will cost us money. They will cost you money. Now, Original Medicare has Part A, and it also has Part B. This is Original Medicare, Part A and Part B. Let's look at that just a little bit further. Now, Part A in Medicare is hospitals. I say Part A is hospitals, rehab, home health care, and I say anywhere you lay your head, that's where Part A covers. Now, a lot of people will tell you that Part A is free. It is not free. When you worked or your partner worked and put in enough credit hours, you paid for Part A. So that part, when you get Medicare, that is usually taken care of. If it's not, again, give us a call. Now let's go to Part B. Part B is for your doctors, any lab tests you have to have, any heart tests, different type, anything that can almost take place in a medical facility. That's what your Part B pays for. Now, Part B is not prepaid for. You have a premium that you have to pay each month for Part B. It depends on your income, and that's something else. That's an individual discussion that we can have with what your Part B will call. Now, we're going to skip the C for right now. I'll tell you about that later. And let's Part D. Part D is your prescription drugs. And this is part of, that's why I say A plus B equals C and sometimes D, because on this next slide, we're going to look at when you get on Medicare, you have three choices. You can have Medicare, just Original Medicare, Part A and B, but you need a drug plan, because if you don't get your drug plan within 63 days, you will have a penalty of 1% for every month that you could have been in the drug plan. So you don't want that penalty. Now, if you have, you're still working or you have coverage from your job, that's another situation. We can discuss that with you later. The second choice you can have Original Medicare, and you can have a supplement. Now, the supplement, when you're on Medicare, Medicare takes care of 80% and you're responsible for 20%. But you can add a supplement which has a premium with it, and you also need to add a drug plan. You always need to have a drug plan. So Medicare your first choice is Medicare and a drug plan, or Medicare and a supplement. You can have what is called as Part C. Part C, first it had different names, but they named it Part C, and then eventually they started calling Part C the Medicare Advantage Plan. So in order to have a Medicare Advantage Plan, you have to have Part A plus Part B, and then you can have a Medicare Advantage Plan. And most Medicare Advantage Plan include the drug plan. Now, you might say, well, why would I want to get a Medicare Advantage Plan? Because a Medicare Advantage Plan has to cover everything that Original Medicare covers, plus more. You can get more benefits with a Medicare Advantage Plan. Most of the Medicare Advantage Plan have a zero premium, and you can get things like dental, vision, hearing aids, over-the-counter, items, just a lot of things that comes with your sometimes transportation. That depends on where you live and what's available in your area and what your situation is, what that you can get. But when we talk to you, we can sit down and customize a plan just for you. Now, Medicare, again, Medicare plus a drug plan, or Medicare plus a supplement plus a drug plan, or a Medicare Advantage Plan. That's why A plus B equals C, and sometimes D. That's your Medicare Advantage Plan. Now, how do you qualify for a Medicare Advantage Plan? You would think you would call Medicare or go to the Medicare site. No, you go to Social Security site, which is ssa.gov, ssa.gov, and that's where you will apply for your Medicare card. Your Medicare card back in a couple of years ago, it was a Social Security number with letters behind it, but because of identity, they changed it, and now it is a combination of letters and numbers. And when you apply for your Medicare card, make sure you get the part A and B. You're going to need both of them. So if they ask you, do you want B? Yes, you want B. If you don't understand why you want B, give us a call and we'll let you know why you need that part B. So again, we are here to answer any questions. We have answers. If there's a question we don't have the answer to, we will go and find the correct answer for you, because everybody's plan is different. Everybody's plan is unique. Again, thank you for joining us here on Let's Talk Health and Medicare. I am Gayle Lawrence, 817-381-1500, GELHealthAdvisors.com. Know your options. We're here to give you any type of Medicare health insurance. That includes dental, vision, hearing, accident, cancer, hospital cash, and guarantee issue. And we also have life insurance that have health benefit. Just give us a call. And thank you for coming.